Moving on, we have our second keynote by our eminent guest of honor, Dr. Kholood Ateeq Al-Mutawa, MD, RT-PCM, Public Health Senior Consultant, Executive MBA, Paris University. Dr. Al-Mutawa is the head of the non-communicable diseases in the Ministry of Public Health in the state of Qatar. She is highly involved in implementation of health promotions, including diabetes projects, tobacco cessation, mental and addiction, accidents and trauma, and many public health related research. She is leading many national programs, improving the governance management model for non-communicable diseases in Qatar, and she is a NCD regional focal point, chair of EMRO Bureau of the Protocol to eliminate illicit trade in tobacco products in Geneva, and as well as the WHO FCTC focal point. Dr. Al-Mutawa's keynote is on experiences in digital health and telemedicine for NCDs in the state of Qatar. Over to you, dear Dr. Kholood, and the stage is all yours.
Good morning, everyone. Thank you, Mr. Roger, for the introduction. I'm very honored and I'm very pleased to join everyone and my colleagues here in this summit. I will be sharing my presentation in a second. Yes, if you can see the screen, the presentation, Mr. Roger,
Yes,
everyone.
Yes, we can.
As you stated, my presentation will be about experiences in digital health and telemedicine for the NCDs in my country. As everyone knows that more than approximately 56 million global deaths stated in 2012 and 38 million, approximately 68% attributed to NCDs. NCD is very important, and we're trying in all the countries, actually, with the, of course, the help of the WHO, to decrease the NCDs and the risk factors attributed to the NCDs. As everyone knows, that health promotion is a process of enabling people to increase control over their health and its determinants, and thereby improve their health. So in the Ministry of Public Health, we educate, promote, and prevent. Under the umbrella of the National Health Strategy that was initiated back in 2018 to 2022, and Qatar Public Health Strategy as well in 2017 until 2022 finished recently, a lot of health programs were implemented. I was responsible for implementing more than 15 programs of those strategies. So, as I stated, we educate, we increase the awareness and raise it of the population, and use the awareness events calendar across key stakeholders. We implement educational sessions targeting academic institutions, school, universities, and I will be sharing examples of those events. Prevent, we have this program, which is a healthy lifestyle program. We promote healthy lifestyle promotion. We address lifestyle risk factors like diet, increasing your exercise, and of course decrease the consumption of tobacco. Those are some of the school outreach that we used, especially materials and educational pamphlets and materials that we used either online or physical. We printed those materials and we used them during the crisis of COVID-19 online. You can see those educational materials towards mainly the community and the school environment. We had community engagement. We used digital awareness lectures, especially during the crisis. You can see examples of healthy lifestyle digital lectures, nutrition, mother and child nutrition, about the importance of lactation, and of course dietary, good dietary habits for children, the importance of physical activity, and especially at work, and you need to exercise more, use the stairs, for example, and the importance of increasing your exercise. Collaboration between organizations, especially ministries. We had collaboration MOUs with many ministries, implementing a lot of programs, especially during, of course, a crisis. Many laws and legislations were implemented in the state of Qatar. Collaboration between organizations as well. You can see here photos about attending many, let's say, healthy awareness campaigns inside the organizations. Promoting healthy lifestyle also in among workers. We have this program named Mutawa, which workplace wellness program, WBW we call it, toward the laborers and the industrial areas. This is examples of Muzawala during the crisis and the war and the WBW and the Ramadan healthy messages that we started to implement and approach the community as well. And you can see it even in all the websites of all the health organizations in the country. So the problem that happened during the COVID-19 pandemic, we closed many of the non-emergency services. We tried to find a new path for health promotion, as well as the quarantine-related stigma was increasing, and the need for, of course, mental health support. So I use here an example of the project of mental health project as an example of the intervention and use of the telehealth. So collaboration between mental health stakeholders. We launched a mental health hotline, and we use a tele-psychiatry line, work on 3 levels. The first level based on the problem itself. The second level, available resources help the individual. The third level is the psychiatric support. And of course, in the autism awareness e-line, we use the e-learning website. You can see here also a photo of the captured of the 16,000. It is the helpline that was launched during the crisis to provide support for people experiencing stress or anxiety during COVID-19. We targeted mainly 4 categories: children and parents, older people, adults, as well as healthcare workers. This is also an example. You can see here the mental health and well-being website. Also, like I said, the hotline, and some of the example of how you can support yourself, and links. If you click those links, it will guide you to the Ministry of Public Health website, as well as Sahha Nafsiya website, which we try to implement many, let's say, information about how you can support yourself during the COVID-19 outbreak, anxiety, how you can overcome anxiety or stress as well. Of course, there is also a link to autism e-learning information. This is another example. You can see here a daily schedule while at home, what you can do, a detailed task actually, what you can do, especially for any special need children, autistic children. Also, you can see in the middle here the corona during the COVID-19, how you can, information how you can help yourself prevent having the corona virus, and how you protect yourself and your family, and an example of the autism e-learning as well. So, about the use of the new digital technology in mental health. We established National Mental Health Helpline, like I said. We received over 13,000 calls, and we implemented tele-psychiatry and virtual clinics. This increased the activity more than 26% and reduced no-show by 16%. Used digital platforms for providing advice, information, and social media platforms as well. And the use of mental health services, it makes the people provided the online training provided by the ministry. People were taking an active role in their mental health stability, and will reduce the non-attendance in the psychiatric hospital later on. This is some of the challenges and lessons learned to share. The difficulty finding the right people to answer the mental health hotline, and of course easing the transfer from the COVID hotline to mental health hotline, and sharing, it helps us in the sharing information, and collaboration as well with partners is a key to success. So as I said, it's a plan for innovation. Let's say we establish an emergency channel for communication for future use. We provide a safe, non-judgmental hotline, very private one. We decrease the stigma in the community by validating the need to talk, and we establish a database for mental health research for future. Way forward and what will be done next. We plan to ensure establishment of a national permanent health line to compile all the service provided, a telemedicine that involve assessment and treatment, and the use of telecommunication technology, for example, video conferencing, website with a comprehensive information, developing standards, technology, as well as applications for telehealth providers as well. Thank you. Thank you, Mr. Roger, and thank you, everyone.
Thank you, Dr. Kholood, for the insights and valuable knowledge imparted with us today. Your intellect is truly valued. Thank you once again, and continue to have a great day ahead.